Go ahead.
All right, so my name is Victoria, and my group had torn ACL, and my teammates were Annie and Tori. So what is an ACL? ACL stands for anterior cruciate ligament, and it's located in the knee, and it's the tissue that connects the thigh bone to the shin bone. So what is a torn ACL and how does it get torn? A torn ACL is when you tear your anterior cruciate ligament in your knee, kind of like this one I was explaining. They usually occur when you are playing sports, so this could be anything from basketball to soccer to football to skiing to tennis. And a simple trip or fall that twists the knee can also result in a tear. So basically you're looking at anything where you're moving your knee in a way that it wouldn't be moving normally, or where you accidentally hyperextend it, and it's not good. So symptoms and assessments. Symptoms include hearing a loud popping sensation in the knee, severe pain and inability to continue activity, rapid swelling, loss of range of motion, knee instability, swelling, and stiffness, and a feeling of instability or giving way with weight bearing. So this is a picture that goes over the different symptoms and kind of helps explain them just a little bit more. So feeling a pop at the time of injury is definitely a major indicator. Swelling after the injury is also an indicator, as is deep pain in the knee. At certain times, the knee will feel like it's giving out, and the knee may feel warm to the touch as well. So those are some symptoms that are commonly reported when your ACL is torn. So causes. Sports or any other activity that places a lot of stress on the knee, and aside from sports, this can also be running or hiking or any other activity that is active. And specifically, randomly stopping or pivoting with your foot firmly planted and landing awkwardly from a jump will increase your chances of an ACL injury. This is why you see a lot of them in volleyball or football or sports where you're a little bit more constantly active, as well as basketball too. And an ACL tear may also occur when the knee is hit directly. And falling off of a ladder, a car accident, and missing a step on a staircase can also cause your ACL to be torn. And other risk factors can include gender, age, previously tearing your ACL, as well as the sport you are playing. So kind of going off of the gender and age thing, I found that when you are female, you are at a greater risk to tear your ACL just because of the way you are built, and for age, obviously, as you get older, the tissue kind of wears down, so you're at a greater risk for getting a tear as well. So this is just another picture that kind of explains it maybe a little bit more in detail and can help you visualize it. So when an ACL injury occurs, it's when the bones and the line twist in opposite directions under full body weight, so you can kind of see the ACL tearing a little bit there, and you can kind of see what that looks like. So diagnosis. An X-ray helps rule out a bone fracture, but does not show the soft tissue. So once you get the X-ray, you kind of figure out that the bone isn't broken, but then they kind of have an idea that, okay, something else might be going on. And usually that's a pretty good indicator that you're working with an ACL injury. So then you go to an MRI, which will help show the extent of the ACL injury and whether or not it's only a minor tear or if it's a major tear. It'll kind of show you what you're working with in terms of the extent of how bad you teared it. And in some cases, an ultrasound may also be used to figure out how bad the situation is. So for treatment, they have this saying called RICE, which stands for rest, ice, compress, and elevate. So basically what this means is once you tear your ACL, you're going to want to rest it, you're going to want to put ice on it and compress it, and you're going to want to keep it elevated. So basically it's all about limiting the movement on it for a while and just making sure that you give it the time to properly heal and get back to 100%. So rehab is also an option. So you're going to need that to help make sure that you can, get back to normal, and even if you're in sports, that you might even have a chance of going back to that eventually. So surgery is also needed, and basically what they can do is they can remove the damaged ligament and they can replace it with a tendon. And usually this is done mainly with athletes when more than one ligament is torn, or the knee buckles during everyday activities. And after surgery and after everything, you're going to need continued rehab and physical therapy afterwards just to make sure everything is okay and everything is going as it should. So for prognosis and follow-up, it's pretty much a favorable prognosis. It may take 6 to 9 months to return to full energy after surgery to reconstruct an ACL injury, but this is to be expected since it's a pretty major ligament in the knee. You need to follow the doctor's instructions for wearing a brace, which will limit the movement of the knee, and it'll help make sure that it heals properly and almost back to 100%. And resting your knee when possible is also important just because it takes the strain off of the knee and it really helps it to recover as quickly as possible. And there are references, and thank you guys for listening.